Hey, Dr. Wilson here. I'm a molecular and structural biologist, and I'm back to debunk some more COVID-19 misinformation. This week, I'm taking a look at somebody who I've heard has gotten pretty popular in Europe. His name is Ivor Cummins. So, I checked out the most recent video on his YouTube channel, and it's an interview with an Irish doctor, Pat Morrissey. He is a medical doctor who has spoken out against the lockdowns and other government handling of the COVID-19 pandemic. And there were parts of this interview that honestly had me thinking I might agree with him on a lot of points, but then it just goes completely off the rails. Let's start by listening to him to see what he has to say.
These issues were not attended to at all in terms of the planning and the strategizing by NEFIT. As well as this, I had increasing difficulties trying to work up patients in relation to cancer diagnosis and heart disease and diabetes. And these issues, as we all know, are quite serious. And even though there is a timeline that we can operate in relation to these, especially in relation to cancer. If things aren't caught early, it will result in worse outcomes. And there's modelling, I saw the modelling done in the UK that showed that there's something like 35,000 cancer diagnoses have been missed due to their lockdown.
Yeah, this is a valid criticism. Lockdowns do have negative side effects, including increases in mental health crises and missed cancer diagnoses, which we should recognize and do our best to deal with. However, lockdowns, as we'll see later, are really effective, and they're just not meant to be used as long-term solutions. So it is a valid criticism, but let's keep going.
An opportunity arose for me to speak at the Health Freedom Ireland rally.
Hold on. Yeah, that's the unpeer-reviewed report that claims that coronavirus was made in a lab. That's not a good sign for the rest of the video.
You know, there's a lot more than just a virus. Um, and even if it was just a virus, the reaction to it is exaggerated and out of proportion.
No, I wouldn't say that the response is blown out of proportion by any means. I would, however, say that it's uncoordinated.
I'm just asking for people to have a debate, look at the evidence on a wider context, and maybe we can come to a better solution. This is what I'm asking for.
Sure, let's look at the data.
This latest lockdown strategy is destined to failure. It has no long-term strategy in mind except the prospect of a vaccine that doesn't yet exist.
Out of everything that he says, this is what I most agree with. Lockdowns are not a long-term solution on their own. You need to do other things in combination with lockdowns in order to have real success. I think that the decorated science writer Ed Yong said it best when he commented on America's response to the pandemic by saying that we have a problem with a serial monogamy of solutions. What he means is that it seems like we only have attention for one solution at the time. One month we'll be discussing lockdowns and debating over that. The next month we'll be discussing masks. The next, contact tracing. What we need is a coordinated effort that includes all of these tools, because we need all of these tools to be put in place in order to control this virus. Lockdowns are not enough on their own. Masks are not enough on their own. We need all of this stuff. That's the problem that most countries are facing right now.
Everybody knows about Sweden, although they sometimes form opinions that are not really based on fact. People say that they have had excess deaths greater than what we've had in Ireland, but they don't compare like with like.
Well, if you want to compare like with like, Sweden has done significantly worse at dealing with the COVID-19 pandemic than its neighboring countries. Their excess death spike, for example, was much higher than all of their neighbors.
Sweden has a much older population, and when you do compare and contrast the demographics, they have done just as well as us without suffering any of the economic cost and damage that we have here.
Well, yeah, Sweden has about 5% more elders than Ireland, but again, its neighboring countries have either more or just as many elders as Sweden, and they performed much better, so that doesn't explain it. And no, Sweden did not avoid damage to their economy. That's because it's hard for your economy to function when you have a respiratory virus spreading uncontrollably through your population. When we do as he asked and look at the data for the entire world, it is very clear that the trend corresponds to this fact, that the more deaths per capita that you suffer during a pandemic, the worse your economy will also suffer. It is a lie to say that this is a choice between saving the economy and saving lives. The two are one and the same, and the data show it.
It now results in a country that has the lowest rate of COVID in Europe. This is an undeniable fact.
No, it's not. But what is an undeniable fact is that for almost all of the month of May, Sweden had the highest per capita death rate in the world when it comes to COVID. And they never had the lowest COVID rates in Europe. Not currently, not in the previous months, not ever. And they're currently having a huge spike. So
we can see the success of Sweden. We can see the success of the state of Florida. That's 1 month into a cessation of their lockdown measures.
Well, again, if we look at the data, we see that Sweden was not successful. Wait, what did he just say?
We can see the success of the state of Florida, state of Florida, state of Florida.
What? If you're calling a state that has more COVID cases in 1 week than the entire continent of Australia has had the entire year a success, I don't know what to tell you.
They are a perfect example in that they had lockdown measures and they quashed them.
Florida never got their COVID situation under control. After their first spike in cases, the lockdown helped them get their cases down, but still, daily case counts remained around 1,000 a day and more. And now they're having a second big spike. How do you call that successful? Florida? Man, really? Wow.
And there has been no spike in cases. I'm talking about facts. I'm not talking about speculation that this might happen or this could happen. Let's look at what's going on in other parts of the world.
Well, if you don't want to talk about what could happen, then your earlier comments about cancer diagnoses are off the table. But in reality, we have to talk about what could happen. It is necessary, obviously, to plan and prepare for disasters. And the way we do that is, like he says, by looking at the data, analyzing it, and also learning from history. So let's do that. I talked already about how saving lives is how you save the economy in a pandemic, and we see that repeated through history as well. During the 1918 flu pandemic, cities in America that locked down and had longer-lasting non-pharmaceutical interventions to fight the influenza pandemic, on the long run fared better than cities that did not. That's because those cities were able to get their cases and deaths due to influenza under control to the point where they could have their economies function unimpeded faster than the cities that did not lock down. We see this trend repeated today with COVID-19. Countries that enforce strict lockdowns followed up by aggressive measures to fight the virus, such as mask mandates, mass testing, contact tracing, and social distancing policies, had the best success. So, if you don't want to go into lockdown again, and you want to make this one count, get your elected officials to do the right thing. Demand that they direct resources into things like mass testing, contact tracing. Wear your mask and get your officials to enforce mask mandates. Do practice social distancing, and do make sure that your areas are well ventilated. All of these things are necessary and much easier to do than going into mass lockdowns, which again, like I said, are not long-term solutions on their own. What you should not do is deny reality by saying that this virus is overblown and that we can somehow get back to some semblance of normal life without any precautions. It's just not going to happen.
My family, my children, the wider public, my community, we deserve to get back the freedoms that we had only so recently.
You know who also deserve their freedom? The now 1.25 million people worldwide who are no longer with us because of this virus. And that number will continue to rise. the longer you don't take it seriously. I think that's going to do it for this week. If that's any indication of the quality of content on Ivor Cummins' channel, I'll probably be back debunking another one of his videos sometime soon. Anyway, I do hope you found this video informative. All the links to my sources are in the description below, so you can check them out yourself. And if you liked this, make sure to subscribe so that you can catch me next week, where I'll be debunking some more funky stuff. See you then.